So now let's talk about weight loss in use and what the recommendations are. So, we several slides back, we talked about the increase in childhood obesity tripling over the past, say, 20, 30 years. So, what are the recommendations if you have overweight use? The main thing is to not necessarily focus on weight loss per se, but try to maintain their weight, because the good news with kids is that they grow. So, they're going to grow in height. So, what you want to do is slow the upward trend of their BMI. So, can you keep their weight the same, but they're going to grow taller? So, that's going to effectively lower their BMI as they do that. So, that's a good goal. When we had the kids come to work out with us couple years back, we did a very good job of that. We kept their BMIs the same. They maintained their weight, but they usually got a little bit taller. Now, when they would come back after summer, it was usually not very good news of how much they could undo that. But during the time that they're here with us, we could keep them active sufficiently that we're able to sort of, halt their BMI upward trend. So we were very happy about that. Also, the kids we had ate very minimal fruits and vegetables. So if there's one thing that the students really talked about with the kids is increasing fruits and vegetables, and how much they enjoyed fruits and vegetables, eating a healthy breakfast, eating breakfast, but also that being healthy. We looked at the school breakfast menus from Rock Hill, and, a Pop-Tart was listed as a school breakfast. So how is the student supposed to make a healthy choice when that is what he's presented with? Or another child was regularly bought, Chick-fil-A chicken and biscuits for breakfast. So not the healthiest breakfast. I mean, kids need breakfast, but they need a healthy breakfast. They also need to make sure they get adequate sleep. A lot of emerging research on sleep, learning, weight gain. So, we talked to some of the kids and they'd say, oh, I watched the finals of American Idol last night, till 11 p.m. So they're going to bed after 11 p.m. and getting up very early to go to elementary or middle school. Increase physical activity to 60 minutes a day. We were able to monitor this with the accelerometers and the pedometers during the time that they're here. So the kids did pretty well on, we got them active with the time that they were here with us, but on days that they were not with us, on days that they didn't have PE in the schools, you could really see from their data that they really weren't active at all. Try to decrease screen time to less than 2 hours a day. I mean, that's a really big goal to do. I mean, that's difficult. Getting kids away, obviously they need to probably be on computers to do some of their homework, but if you can avoid some of the TV and the games and other types of handheld devices, that's going to make a big difference in their health. Get the families involved. It's just unreal, how much you think about what the role of the family in this. I mean, we are trying to work through our Eat Smart, Move More, York County, and our Healthy South Carolina initiative, and all the work we're doing, the Bike Ped Task Force, giving people options. Where can you go as a family to walk and bike together? That's available in Rock Hill. That's not going to put you on a high traffic road like Cherry. What are some small loops where you can go bike ride with your kids? So we've really done a lot to work with that. Getting people involved and, getting the family involved and to say, could you maybe not purchase the Chick-fil-A breakfast biscuit for your child? What's some other things you could do? And of course, advocate for more PE at school. There are lots of data that now indicate that, physical activity does lead to improved academic achievement. So cutting PE is not the answer at all. So in fact, if anything, the more active kids are, the better they're going to perform on their standardized assessments. And as I mentioned about safe outdoor options, parks, we have some pretty good walkability. We have parks in Rock Hill where kids can go that are safe, and try to advocate to keep those, safe and in the public and maintained.